Good afternoon and welcome to what I hope will be the most informative and enjoyable hour on Zoom that you have had in a long time. My name is Jeff Schlatter, and it's my honor to serve as the director of the UCDAVIS Tahoe Environmental Research Center, or TERC. If you want to learn more about us, the research we conduct here and around the world, public education we provide for the local and regional community, and our work with agencies here in the Tahoe Basin, you can visit our website, tahoe.ucdavis.edu. You can also find out there how to follow us on social media and how you can join in and support the work we do. Those of you who have attended our past lectures know that we strive to facilitate interaction, dialogue, and discussion. Easier to say, but difficult to accomplish in the age of COVID. We will be addressing your questions at the conclusion of today's presentation via the Q&A function, which is on the lower right-hand side of your screens. Yelling out comments or questions may be therapeutic, but they won't be heard or addressed. So please also don't use the chat for your questions, Q&A function. So to launch our fall Science Speaks seminar series, we are fortunate today to have my colleague from UC Davis, Dr. Kent Pinkerton, as our guest. Before I actually introduce him, I wanted to say that our next seminar in this series will be in exactly 2 weeks on November 12th, and will be titled Studying the Fate of Microplastics at Lake Tahoe. So it is now my pleasure to introduce Dr. Kent Pinkerton. Kent is a professor of pediatrics at the UC Davis School of Medicine and also a professor of anatomy, physiology, and cell biology in the School of Veterinary Medicine. He has a broad range of interests and expertise, including pathophysiology of the respiratory system and the effects of environmental air pollutants on lung inflammation and disease. It is this particular expertise that makes Dr. Pinkerton so valuable at a time when wildfires are consuming large parts of the West, and we have all been exposed to weeks, possibly months of wildfire smoke, regardless of where we live in the West. So today, the title of today's presentation is Impacts of Wildfire Smoke on Human Health. And now, hopefully, control of this will pass to Dr. Pinkerton.
Well, thank you very much, Jeff. I very much appreciate that introduction, and it is a true honor for me to be able to speak today in your seminar series. I have really enjoyed being able to get to know Jeff and the important work that is being done through the Tahoe Environmental Research Center. I think it's truly amazing that we have such a facility that we can be affiliated with. My association is, as mentioned, with the Schools of Medicine and Veterinary Medicine. I also serve as the director for the Western Center for Agricultural Health and Safety. And I would like to acknowledge at this time the assistance of Teresa Andrews and Heather Ryden, also members of the Western Center for Agricultural Health and Safety, who have been instrumental in much of the work that we've done to talk about the importance of wildfire smoke and how it impacts on health. So, as we're all very much aware, and as Jeff has mentioned, we're seeing a greater frequency and severity and duration of wildfire events throughout the country, but especially here in the state of California. Shown here on the left is a map of California, showing many areas where agricultural activity is involved. And on the right is the 2018 CAL FIRE incidents for wildfire events that occurred during that 1 year. As you can see, wildfires are throughout the entire state of California and impact on many different areas. What is really unfortunate is that we know that the number and severity of wildfires is increasing. that is something that we have seen, especially in this year. As we look at the events that are occurring, we know that virtually approximately 4 million acres of land have been burned by wildfire events. And this is really unprecedented. The things that we have been seeing this year, also complicated by the COVID-19 pandemic, has really created a lot of stress and concern among many residents of California and the Western United States. As I mentioned, working in agriculture and in worker health and safety, this has really been a concern for us, for those who are outdoors, who are essential workers, who must be outdoors. And so this is where a lot of our interest and concerns about wildfires really originates. So the outline of the presentation today will be to discuss health effects, to talk about the air quality index, which I'm sure many of you are very much aware of, as well as the benefits and limitations of wearing a respirator or something that protects us from the particles that are in the air. And then I'll also touch briefly on the emergency wildfire regulation, which was enforced last July of 2019 as the Title 8, Section 5141. So in terms of the health effects, I think we're all very much aware of conditions that can be problematic when we may be exposed to different types of pollutants. When we think about the air that we breathe, it's really a mixture of many different gases and also particles. Particles that can be natural as well as particles that can be man-made. When we think about the pollution of the air, this is really when we are concerned when there are different substances that are added to the air that may be harmful to our health, whether it be our lung or our heart or other conditions. And these can be organic and inorganic particles, especially when we're thinking about wildfires. In terms of particles, there are some that can be seen with the naked eye, as illustrated here. And then there are some that can only be seen with a microscope. And that is really the critical part of exposure to airborne particles. Are they small enough that they can easily enter into our lungs through just normal breathing? So particles also are interesting because the smaller they are, the longer they can be maintained in the air. And that can actually be for days to weeks. And that also leads to the transport of these particles from one region to another. What is illustrated here are particle sizes expressed in microns that we are most commonly confronted with. Large particles of 10 micron. This is kind of illustrated on the right, showing a single shaft of human hair. And those orange dots that you see there would represent a particle that has a diameter of approximately 10 microns. Those are referred to as coarse particles. Particles that are smaller in the range of 2.5 microns are referred to as fine particles. And those are shown as those gray dots superimposed onto that coarse PM10 particle. And then we have a third size category that is considered to be even really small. These are ultrafine particles that are 0.1 micron in diameter or less. And we haven't illustrated them here, but all of these particles are potentially respirable, that we can inhale into our lungs. When we think about the components of wildfire smoke, again, on the right, we're just, again, reminding everyone about the particulate matter and of the different sizes that it can be. If we compare, not only to a human hair, but just one single beach sand granule is far larger than even the coarse particles that are there. But it's important to also remember that it's not just particles that are in the air that can be generated by wildfire, but also different types of gases that are shown here, such as carbon monoxide or carbon dioxide. Dioxins typically can be generated through the burning of biomass, and also different types of oxides of nitrogen, as well as volatile organic carbons, or VOCs. So for those who are not very close to the fire, it's really the particles in the air that represent the greatest hazard. This is just simply showing, as we've seen over and over again this year, the spread of wildfires, the front that is generated, the smoke that is there, and how it can be transported over many miles of distance and impact on many individuals. I wanted to just give one example. This is the average daily concentration of fine particulate matter, or PM 2.5, that was measured in Davis from July to December of 2018. Now in November of 2018, this is when we experienced the campfire event, which occurred and largely destroyed the city of Paradise up in Northern California. And so what we're looking at here in this line graph, or these are concentrations of the particles along the y-axis in micrograms per cubic meter. And what is shown here is that spike of high levels of particulate matter that was occurring here in Davis during that campfire event of Paradise. We are approximately 100 miles away from Paradise, but you can see again that transport can be over very large and large distances that these particles can travel. And I know that in the Tahoe region, as Jeff has mentioned, that you've really experienced a lot of the smoke that we were experiencing also in the valley. The chemical composition of fine particulate matter that we measured in Davis as a result of a wildfire event that was over 100 miles from our area. And what I wanted to just briefly illustrate again is that the brown here is freshly emitted wildfire smoke. So we can actually measure that as it's clearly a carbonaceous based material that is present. But what happens is over time that becomes mixed with aged wildfire smoke that is shown here, that is actually, there's a chemical reaction in the air that that causes an oxidation of that wildfire smoke. Again, we don't know which may be worse, but it is just simply an event that's going on. And this black line here is basically showing the particle concentration where it's peaking and we have freshly emitted wildfire smoke, then it's declining, and now, but we see a greater proportion of the chemical composition of the particles are these aged particles. And then as we go out here, this is actually the normal ambient composition of the chemical composition of the particles. And here's the legend that shows all of that. What I was illustrating here was this dashed line, the triangles. These actually represent concentrations of phthalates. Phthalates are basically plastics that are present in the air that are due to the destruction of buildings through fire and basically the burning of building contents where plastic is involved. And so it really is amazing. We could see these phthalates here in Davis, 100 miles away from Paradise, that were high with the freshly emitted smoke, and then they were coming down. And again, the phthalates are very interesting because we know that there is some health effects associated with it. But again, this is where we have to also consider that wildfires, where buildings are destroyed, can actually create another health condition. This is the air quality index. I'm sure many of you are aware of it. And this is a numeric ranking talking about the quality of the air that basically can go from good to extremely hazardous. We'll talk a little bit about that. So in essence, an AQI or air quality index that's less than 50 is really considered to be reasonably safe. That the air pollution really at that level poses little to no risk. However, if it goes above 50, but still below 100, for many people, that's still acceptable in terms of an air quality condition. However, there could be some pollutants that could create some health concern for a very small number of people. And these are usually people who are very sensitive to air pollution. Now, in terms of going above 100 to 150, these are people who really need to be very careful, because if they have a pre-existing lung condition or heart condition, if they are elderly, or if these are children, very young children, they are clearly at greater risk for having an adverse effect to an air quality index in this range. Now, as it goes above 150, everyone should begin to be concerned about this, because this is where you can begin to experience health effects. And especially sensitive groups, such as those who do have a pre-existing condition, that includes diabetes. They may experience more serious health effects associated with this level of air quality. And going above that, again, these are clearly a health alert. Everyone could experience serious health effects, and certainly above 300, these are where emergency conditions exist. And in fact, here is where the entire population could be affected. Now, what are the health effects? So just this little diagram, we clearly have lots of different cell types. There's over 40 different cell types within the lung, and each one could represent a different target for potential effects due to exposure to particulates. So as we've somewhat mentioned, people who are at higher risk, well, people who work outdoors, those who have that lung or heart disease, people with diabetes, the elderly population, as well as children, and especially also pregnant women, where we have had some concerns there, particularly in the studies that we've done where we realize that there are plastics, these phthalates that are present in the air. So what are the health effects? Well, I think we can all think about something that how we felt, but headache, burning eyes have been a common experience that individuals have experienced. Basically a runny nose or coughing or phlegm or wheezing. And even some people have dizziness or fatigue, or they may actually feel as though their heartbeat, their heart rate has changed during as another symptom of a health effect. So these health effects, can create all sorts of issues, such as difficulty in breathing, or bronchitis, which is an inflammation of the airways. Certainly, if you're predisposed to an asthmatic kind of condition, it can worsen that condition. It can cause a more rapid heartbeat. One may experience pain in the chest, as well as reduced lung function, heart failure, and worst of all outcomes, premature death. So this monitoring of the air quality index that we've talked about, this can be found at many different locations. In fact, Heather pointed out to me that the Purple Air website is another site where you can actually see air quality or AQIs throughout the state. But all of these are good. And I'm not sure one is necessarily better than the other, but the California Air Resources Board clearly has monitors all over the state, as well as local air pollution control districts that we have throughout the state. They also run these monitoring devices. And then even on your iPhone, you can get direct readings of what the AQI may be. So if we have these wildfire events that are becoming more frequent and more problematic, what is it that we can do? If we have to be outdoors, of course, our first recommendation would be to remain indoors, or if it becomes very severe, to leave the area. But what about using a respirator, something to cover your nose and your mouth? So respirators, these are devices that are designed to remove particles or any kind of impurities from the air that we're breathing. And their primary goal is to reduce exposure to particulate matter. To some gases, they're not going to be exactly totally efficient for removal of harmful gases, but they can provide some partial protection, but primarily for particulate matter that may be in the air. So what kind of respirators should one use? And what we've shown here are a number of examples that we've been using. Probably many of us have been using these as part of the COVID pandemic of complying with using a cloth face covering or some sort of surgical mask. But in terms of wildfire smoke, none of these types of masks are very efficient. They really, what they're really doing is that it's more containing our respiratory droplets rather than filtering out particulate matter that's in the air. Just an example of this, perhaps a surgical mask that we're seeing here, either on the top left or bottom left, they might remove somewhere between 40 to 50% of the particles, but they're not form-fitting and they're not going to be able to completely remove all particles. What is needed, as I'm sure many of you are very much aware, is the N95 respirator. So the N95 provides for protection if it is properly fitted over the nose and the mouth. It will remove or block 98 to 99% of all the particles that are in the air, that it will effectively remove that. So how do you put one on? And of course, this is even more rigorous in terms of a type of respirator that could be used for protecting one's health. But the proper use really requires the following: that first of all, we clean our hands, soap and water, and make sure that we do this before and after touching and adjusting our respirator. In order to put on a respirator properly, this should be clearly covering over both the nose and the mouth, and it be under the chin. So the way to approach this is these are typically have the two straps that wrap around the head. That bottom strap should basically go over your head and place it below your ears, whereas the top strap, just put it on your head and rest it on the crown of your head, and this basically gets it in the correct position. Now, in using both hands, you can mold that metal nose clip around your nose to get a secure seal. And to check that seal, if you place both hands over the respirator and exhale, the respirator should bulge slightly. If air leaks, then you can again reposition the respirator on over your face and adjust that nose piece. So if in wearing a respirator, if there's not that proper seal, then it is really not protecting you. And you know, if you adjust the respirator and it still doesn't fit properly, it could be that it's just simply the wrong size respirator for your face. And many of these do require someone who's experienced to make sure that they're fitted properly. One important point to keep in mind, and again, I think perhaps many of us already realize this, is that to properly use a respirator, we really, for men, no facial hair. And now a mustache is okay, but a beard does not allow for the proper fitting, and that there will continue to be particles that will basically enter in the respirator that cannot be blocked. So that's one thing to really keep in mind. Respirators that have this valve breathing resistance, the valve breathing, it does reduce the resistance. One of the complaints about an N95 is that after a while it gets really kind of hard. It's because if you have a proper fit, it's very difficult for one to be able to breathe very easily. But again, and then again, these should be single use, discard after each use. It's not recommended to reuse, so that's something to keep in mind. Now, after having said all of this, we are really in a problem because we have a dearth of having N95 respirators available, simply because of the COVID pandemic, that this has taken a real toll, where these are, the N95 masks are primarily given to those in the healthcare profession who are working with those who have become infected or positive for COVID-19. And so that's a challenge, but they're beginning to be more and more available. So I'd like to kind of end with talking about the wildfire emergency regulation. Now, again, for many people who are in the Tahoe area, this is probably something that you don't really worry about. I mean, I'm sure that many people are finding that, when they're outdoors, it's for recreation, it's for exercise and for this sort of thing. But we really had, this came into being just simply because of the number of wildfires that were occurring without any kind of guidance at all. And this was especially within the agricultural industry, where these are essential workers. They basically must be outdoors regardless of what the condition is. And because it's a piece rate kind of payment. If they don't work, they don't get paid. And so they really have to kind of balance this of, what they can do. But I think, again, it's really important to protect anyone who has to be outside. So the scope of this regulation is really applying to workplaces. So, and it's basically where the AQI is above 151. And so this requires that the employer be reasonably able to anticipate that their workers may be exposed to wildfire smoke. Now, the exemptions are in enclosed buildings or in enclosed vehicles where the air is filtered. Also, basically any kind of work where it's indoors and the air is filtered, as well as in enclosed vehicles. And the employer, if they're not using these masks, they must demonstrate that the concentration of PM 2.5 does not exceed the AQI of 151. And so also, if the AQI of 151 or greater is only for a time of 1 hour or less, then they can be exempt. And then firefighters, they're exempt, but also they have very different types of respirators that they're using as well for protection. So the idea is to basically establish and implement a system for communicating wildfire smoke hazards that is clearly understood by everyone who may be involved. And it provides provisions to encourage employees to let their employer know about smoke hazards without fear of reprisal. There are effective procedures for informing workers. That's being aware of what is the current AQI, and then protective measures to reduce exposures, whether it be encouraging employees to report, if the air quality is getting worse or any adverse symptoms that they may be experiencing. the training really needs to be effective in terms of including all of these different parameters. What are the health effects of wildfire smoke? Why is particulate matter of concern, as well as the right to obtain medical treatment, how to determine what is the current air quality index, and have this communication system and methods for protecting workers, and then being aware of the importance as well as the limitations of using a respirator. So in terms of emergencies, with wildfire smoke, as we're all aware, basically much of it may be evacuation from the area where that high AQI exists, or going into enclosed buildings or structures or vehicles that provide filtered air for further protection. In terms of administrative control, again, this is the California Emergency Wildfire Regulation to relocate work to a location where the AQI is less than 151, or changing work schedules, or reducing work intensity, and providing rest periods. And again, this is really critical to be able to have access and be aware of what the air quality index is for particulate matter. And again, we need to have that protection for anything that is above an AQI of 151. And that the employer is responsible to provide respirators for voluntary use. Workers do not have to wear them. If they decline their use, then that's fine. But the employer must be able to provide them with respirators and also encourage their use. And again, this is just a reminder about the different locations, sites where we can get and monitor air quality. The air quality monitoring can actually be done several times throughout the day to tell us changing conditions, so we know, what our decision should be in terms of whether we go outside or not. And so, and again, the importance of symptoms. I think whether we're working or we're basically, this is just for our own personal information, we really should be thinking about our symptoms and be aware of them, and not remove a respirator until you're in a safe area, or just stop working or exercising and move into a safe area, as well as to never hesitate about getting medical assistance if you are suffering any kind of serious condition in terms of difficulty breathing, a rapid heart rate, or an exacerbation of an asthmatic-like conditions. And again, all workers should have the right to medical treatment without fear or retaliation. So in order to work on this, I'm just going to play this briefly, that we really want to make sure that people are aware. And so the Ag Center created a checklist as well as guidelines to provide for anyone. Now, again, this is primarily for agriculture, but it clearly applies to any other type of occupation, or literally any citizen that is just somewhat concerned about wildfire smoke and what the potential health effects may be. So again, I apologize for that loss in communication, but I'm happy to address any questions that you may have.
Thank you, Kent. I actually changed my background to the current purple air map of the AQI. And those of us who have the fortune of being at Tahoe right now, where our air quality index is in the very low single digits, whereas poor Dr. Pinkerton is experiencing moderate conditions in the mid-70s in Davis. So with that, we have a number of questions, and so I'm going to not answer them. I'm going to forward them to Kent. So the first question is regarding fire retardants used in sort of wildfire control. You may have all seen that pink liquid coming out of planes and helicopters. And the question is, does that have a measurable impact on the air quality?
And the answer is yes. I think our concern about the fire retardants, obviously they are an essential item in combating a wildfire, but there's also the added concern about how they may affect the air quality. Many of these particles will be large enough that they will literally fall onto the ground, that they will not remain suspended in the air for very long periods of time. But fire retardants are based on a chemical that basically with wildfire interaction may actually create certain types of chemicals that could be toxic or potentially harmful to an individual. Our difficulty is that we don't have a lot of information about that.
Okay, thank you. So another question here concerns, I guess, cumulative exposure. I mean, when you have exposure over a few days and then more exposure a couple of weeks later, is it cumulative, or does our health go back to where it was quickly?
Yeah, another really good question. Typically, when we think about just short-term exposures, that's where we see a lot of the symptoms that we experience, such as the coughing or the runny nose or the irritated eyes. And the cumulative exposures were really, we have less information about that. But as we go forward and we're seeing these more frequent and longer wildfires of longer duration, that I think we're beginning to see that there is an increase in emergency room visits and hospitalizations that are occurring. We don't have a real hard and solid data at the moment, but that certainly is a problem. What is interesting, though, is intermittent exposure to particulate matter, where in essence you have a period of having a high concentration of particulate matter in the air, then that goes back to our normal background levels, but then you have another incident. And I think this is where we have the concerns with the wildfire events and the AQI that we've all experienced over the last couple of months, where we have a high AQI one day that might last for a couple of days, and then it goes down. So are we safe? And then it comes back up again. And those intermittent exposures actually could be even more problematic because of the fact that they initiate an injury or an inflammatory response that then resolves, but then basically comes right back again as the AQI index goes back up again. So, and again, we don't have a lot of solid information on that other than from experimental settings.
Thank you. So a couple of questions about masks, and you were talking about the N95 masks, but there are some that are marketed as KN95. Are they the same? And also, do masks come in different sizes for children, for people with larger head sizes?
Yeah. The NK95 is considered to be close to an equivalent to an N95 mask. They are fairly effective. They may not have quite the form-fitting requirements that we would like to have, but they actually are pretty good and are a very reasonable alternative to an N95 mask. In terms of different sizes, obviously we've kind of seen that with the cloth face coverings where they've been designed for different sizes. But what is interesting is that there are ways, if you don't have an N95, to actually work the strings that go around your ears, that you can actually be able to tie a knot close to the end of them, and or to just flip them over in an X that actually helps to prevent, that allows for a better fit on the sides of your face. Again, these kind of surgical masks are still not completely satisfactory, but do provide some partial protection if an N95 is not available. But again, for children, it really all depends on the face. Again, obviously there are some masks that just are not going to be very helpful for children if they're really designed for an adult.
Okay, still talking about filters, but not masks. Filters for buildings and homes. If one studies the purple air map, some of the sensors, the ones surrounded with a black circle, indicate indoor air sensors, and they're often a lot higher than the outdoor air. So what can we do? Can we get N95 equivalent HEPA filters, or do we just, well, what do we do?
That's a real challenge. And in terms of the being indoors, obviously that is the one recommendation when we have a bad AQI outdoors, that would be the recommendation to stay indoors. But again, that is most effective when you have an efficient filtering system for the air that is coming into your home. There has been some recommendations that one check their filters in their home and change them on a more frequent basis if it's very clear that they're becoming clogged and no longer effective. The true filtering for air really would involve using a HEPA filter. And again, those are very effective in providing proper filtration of the air. So again, though, it's a really interesting question about what we should do with something like that. I would hope that if the indoor air AQI is worse than the outdoor AQI, I would open up the windows.
Yeah, all right, that's coming from the expert. Thank you. And so this is a question I'm interested in as well, and I'm not sure the data is there yet. Is there any connection, correlation found between the wildfire smoke exposure and COVID and the severity of COVID symptoms?
A great question, Jeff. And in fact, that has been...
Not my question, it's somebody else's great question.
Well, a great question, whoever you are. And that has been a very much of concern, because those people who are most susceptible are those who already have a pre-existing condition. It could be, a respiratory, cardiovascular, or especially diabetes. We're very concerned about those who have a diabetic state, that they are not only more susceptible to poor air quality, but they're also more susceptible to potential infection or risk of infection to the novel coronavirus. Whether those two play together or whether they're just they coexist in the same regions, we don't know. But again, one of our concerns in our agricultural workers is that not only are they being exposed to wildfire smoke, but they have a much higher incidence of the novel coronavirus infection compared to other workers. And that can be during wildfire events or in other conditions. Again, a lot of this has to do with the spacing, the regular washing of hands, the wearing of a face mask, a cloth face covering. All of those are very critical in trying to minimize the dissemination of this infection to others.
I guess a question about whether the Ag Center you've been talking about is open to working with vendors and specialists to help create solutions for specific industries. I presume the answer is yes, but if you could, right after we finish, provide that contact information to Heather, she can distribute it to everybody, and people can presumably contact you and get advice, at least from your staff.
We'd be happy to do that. And yes, we do have a website for our Western Center for Agricultural Health and Safety. And we also are more than happy to provide checklists and training materials for individual use, if that would be appropriate. These are large enough to, and they're laminated so that they can be stored and used and brought out when there's a need. We actually even provide guidance in providing, even if you're not trained in how to deal with wildfire events or protection, that we have a dialogue that can be used to train others about these issues that are associated with the health impacts of wildfire smoke.
Okay, thank you. I lost my next, my question. Okay, so what are the effects on food and wine and things that are growing in this smoky environment? Does that have a health effect on us?
And I'm really not qualified to give a reasonable answer for that. We certainly know at Davis that the wildfire smoke has created some problems for the wine industry, in that those particles do interact with the skin of the grape to change the taste and of that. In terms of other types of food products, I am not aware of any kind of potential health effects that would be associated with that. There's always that concern with people coming back to areas where they've lost their homes, and they trying to understand, trying to find something that's in the aftermath of a fire, where there's concern there of whether the ash that's on the ground could create problems for them. And again, that may be the only thing where I would have some concerns, but I don't think in terms of food products, if they're washed and cleaned, I don't think that would be a problem.
Okay, well, here's a question that it's actually something I've been told works, but I don't know. Is putting a coffee filter inside a cloth mask effective, or just the waste of a coffee filter?
For the cloth face coverings, filters like that have also been recommended. If you have a blue shop towel, that's also considered to be something that could be effective to a limited degree. But again, I'm more familiar with the blue shop towels that have been used. They've actually shown those where you've only have maybe 50% protection. You can bring it up to about 80 to 90% protection, having one of those inserts in your cloth face covering.
One of the issues here in the Tahoe Basin is that people who are forced to work outdoors for many hours at a time often are forced to live in quite substandard housing. Do you know anything about how long sort of very leaky, low quality construction housing does protect you? How long does it take before it's the quality of the outdoor air?
Yeah. And again, a very reasonable question that's being posed. but I don't really know. I mean, in terms of, that kind of condition, I mean, we're very concerned about housing for workers, and especially migrant workers, where the housing is of poor quality, but it's more of their being together too that actually creates some issues, and that may be more for COVID than it is for the wildfire smoke. Also transportation, people going together. But in terms of the housing like that, again, I would be concerned that we don't know what the AQI is within the house compared to outdoors. And again, again, it would be kind of based on symptoms. Are people having problems with breathing? Are they sensing something is different because of the quality of the housing? There's lots of indoor air pollution as well that we have to be somewhat concerned about.
Okay, well, we have quite a few more questions, but unfortunately, we've come to the end of our time. So, Kent, thank you very much for making the time, sharing your expert knowledge, and I think we've all learned a lot of how to be safer during the fires that are yet to come. Just before we finish, again, a reminder, we have another seminar on plastics in the lake coming up in 2 weeks. So I'm sure you'll be receiving notification. So once again, thank you everybody for attending. Thank you very much, Dr. Pinkerton.
Thank you. It was my pleasure.